Let's talk about representation in specialties. So, Dr. Salas, surgery. I mean, this is your field. Tell me about where we're at with equity in surgery and that, and also just your sense of like how the field has changed. I mean, when I was a medical student, look, it felt pretty male dominant. Like I've had surgery myself actually a couple of times, and I've had female surgeons. So to me, it's like, oh, whatever. But like, if you actually look at the numbers, like I remember being scrubbed in. Like it was a boys' club over there, right? I mean, so that was 10 years, 15 years ago. I haven't been in the OR in a while. What's the culture?
Yeah, I mean, I think there is maybe some very small gradual change in the culture, despite pretty massive, I think, shifts in the gender dynamics. Even this morning, I was looking at some of the programs announcing their match results. And there were a number of programs, like University of Washington was one that I definitely saw, but many that had more women than men in their match class for general surgery, or one of them, I think it was University of Washington, had like 7 women and 1 man, which by the way, was my intern class was 5 women and 1 man, but back, a million years ago. But the point that I'm trying to make is that even though we do have a lot more women going into general surgery now than we have really ever before, the culture has not really changed enough to keep pace with that. And so I really actually worry about what these trainees are stepping into. And even though in residency, they might see a lot of women around, like there are many programs in this country that now have 50% women residents in their general surgery program. That changes pretty drastically once you go to be faculty, or even if you go into private practice, where still the majority of surgeons in this country identify as being men. And the culture is still driven by that. And it's the same issue, I think, that we see in every specialty, really, including the ones where there are majority women, like pediatrics and OB-GYN, because the culture that we've inherited is the culture of the practice of medicine, which was created by and for men in a specific point in time when we were not thinking about any of the issues that we're all discussing today, for a lot of reasons. And the change is slow. I mean, if you look at simple things like parental leave, we don't have obviously federal paid parental leave, but even in healthcare, we don't have really clear policies in most places. It's only last year the ABMS came out with a policy requiring that trainees get 6 weeks, which is well short of what AAFP recommends, right? Okay. And that's just in the 2020s that we've gotten to that point. Whereas like Google and all these other tech companies, which I always like to use as a foil, have been doing that for years. And why are we in healthcare not providing health support to our own employees? So that's just parental leave. And then there's obviously lactation support and time that it takes, and having places where people can actually pump while they're at work without financial penalties. That gets back, by the way, to the pay gap. And there's so many things that are going on that we're not paying attention to in healthcare. Never mind, like one of the things I do a lot of research on, I think you both know, is related to fertility and family planning. And most places do not provide any insurance coverage for their trainees or for their staff to get those kinds of treatments, even though we know that women physicians are about twice as likely as other women to experience infertility. So I think we're very behind, and that's true in surgery as much as it is in other specialties in medicine. But I think you would be right to say that maybe surgery lags even a little bit further behind in many ways.
So there's the issue of where people sort of self-triage because they see the culture and they see themselves as part of it, or they feel welcome or unwelcome. And then once they're within their fields, there's advancement, as we sort of briefly already kind of touched on. So Dr. Jane, I want you to talk about that a bit. When the dust is settled, everyone's matched and they're in their fields and they're going along. But that's not the end of it, because even in the fields where you have maybe a little bit more equity, or even more than equity, like overrepresentation, there's still not equity in leadership. Can you talk about how you've seen that play out, and has anything gotten better there?
Yeah, it's a great question. And it's a really sad point that we have over 50% of matriculating medical students are women, but we are not even close to seeing that representation in leadership. When you look at deans and chairs and C-suite, it's all less than 20% women. And it's not because the women aren't ambitious. I mean, we all enter into medical school wanting to be great doctors. Many people enter into medical school wanting to be leaders. The problem is there's this, they call it a leaky pipeline, but I really think it's just a hemorrhaging of brilliant women physicians. And the reason, there's multiple reasons why it happens, right? One reason is this kind of hustle culture that Dr. Salas was talking about. And one, if you have a uterus and you decide to get pregnant, that takes a toll on the body at some point, and you have to figure out how to adapt that into your work-life balance. I have 3 kids. I have an 8-year-old and twins who are 5. And I will tell you, it is not easy. And when I was in training and I got pregnant, nobody seemed understood why I got pregnant, how I get pregnant, and how it was going to impact my career. When I found out I had twins, I had people tell me, oh, your career is over. You're going to stay home now, right? I'm not nominating you for any leadership positions. So there's this concept of, a woman being able to be a parent and also be able to be a leader that again, feeds back into implicit bias. And then there's a bullying culture that exists in a lot of healthcare, whether it's in surgery, as Dr. Salas mentioned, or throughout healthcare in general. We have a very hierarchical system that was set up before women were in the workforce, and so in the healthcare workforce. And there's this idea that bullying is tolerated in healthcare, and not only is it tolerated, a lot of times the perpetrators fail up, where they will do the bullying, and then if they have somebody report them, instead of actually having any repercussions, it turns into a he said, she said. Typically, the woman is kind of swept under the rug and oftentimes leaves the field altogether, or doesn't feel like pursuing any other opportunities, because who has time to deal with that? And the man will end up failing up and getting a position at another institution. It's been reported over and over again. So a lot of times bullying isn't even reported, or if it is reported, there's negative repercussions on the woman. I have been told numerous times not to report things, specifically because it would be a career ender for me. And they've said, if you want to be a martyr, you should absolutely go forward and say something. But if you don't want to be a martyr and completely ruin your career, like, is this one situation worth destroying your career over? And so I think that concept of reporting structures and having a way to safely allow people to come forward when something like that is happening, and then knowing that there'll be repercussions for the person who is a perpetrator, I think that is a huge culture shift that needs to happen in healthcare. And then on top of that, there's so much data out there showing that women aren't nominated for leadership positions as much. Women aren't given awards as much. Women aren't provided the grant funding. You were asking about numbers earlier. There is data from the NIH that shows women get less money in grant funding and they get less grants than their male colleagues. It is documented by the NIH. I think the good thing is now we're talking more about it. We have an immense amount of data showing this is a problem, but we are at a point in time where we either need to focus on solutions and how to fix this system that is so broken, that is really causing this great resignation everyone keeps talking about. Because if we don't, we're going to end up chasing more and more brilliant women away from medicine and from healthcare altogether. And we're seeing it. I mean, the match just happened, and we're seeing, match spots going unfilled in primary care, in ER. We're seeing places where we really need healthcare workers, and we need leadership, and we need women. They're not interested in doing those things because they know all of these barriers exist, and they have things change as much as it really should by now.
A lot of these issues aren't just affecting women, right? The things that both Dr. Jane and I advocate for would really benefit everyone in the healthcare system. Having humane working conditions, having work be recognized, all work be recognized and valued, to the point that Dr. Jane made earlier, by the way, about that McKinsey study. Like, they specifically looked at DEI, diversity, equity, and inclusion, and well-being, and they shared to what proportion of the companies they surveyed said they valued those things, which is a very high proportion. It was like 75 to 80% said they valued those things, and what proportion actually financially remunerated people for doing that work, and it was about a quarter. So those are the issues that, again, may disproportionately benefit women because women are doing that work more, but they really help everybody to truly value the work that we say as organizations we value, and value it financially, value it when we're looking at promotions, value it when we're looking at opportunities for career development. And the other thing I wanted to say to counter this, what Dr. Jane was saying, often people say to me things like, well, women just leave the field. So we shouldn't even train women to be physicians. Or you've taken, and people have said this to me directly, you've taken up a spot that should have gone to someone else. Because I don't know if all your whoever will see this are aware, but I'm not currently practicing. My relationship with clinical practice is a little hot and cold, mostly cold. And it's because of a lot of things Dr. Jane was describing, and my unwillingness really to put up with the mistreatment that I was experiencing, which other people are experiencing too, and not just women. And I should note, by the way, disproportionately women of color, people with multiple marginalized identities, but it's not just us. Everyone is, in my opinion, is being mistreated in some way or other in healthcare because of the way our current system is. And that's why we're seeing such large numbers of nurses leaving the profession, such large numbers of physicians intending to leave. And so the same pressures that make women force us to make these very difficult decisions and cutting back our time or potentially leaving clinical medicine are really impacting everyone. And so it's really to benefit of all of us to fix that. And it's not that women are leaving because we can't handle it. I mean, I get that too. Oh, you were just too weak. No, I'm just making a different choice. Like, you can choose to be harassed all day long and still show up. I choose not to do that. And that's not weakness, So I just want to reframe that a little bit for people who are sitting out there going, ugh, these women, all they want to do is complain. And really what we're saying is that we all deserve humane working conditions.